evening, everyone. My name is Father Tom Daly, and I direct the Salesian Center for Faith and Culture. And we are happy to bring you this first event in our Heritage Week celebrations, where we try to link the spirituality of St. Francis de Sales, the patron of the university, with various subject areas that you study. And the first one that we do is always on medicine.
We base daily medical decisions based on best evidence, but can never really be certain what the result will be. Faith gives me the understanding that by myself I can do nothing. By following God's will through routine tasks and all the things that I learned to do in medical school and other places, thinking and listening to patients and families, God can do great things. At the hospital where I work now, St. Joseph's in Chippewa Falls, Wisconsin, the patron saint is another St. Francis, Francis of Assisi. He has a quote that goes, preach the gospel all the time, and then when all else fails, use words. Working as a surgeon gives me great opportunity to live my faith in a very real-world situation, and hopefully let God's work through the serious and not so serious tasks shine through each day in everything we do. Thank you.
We don't always have a lot of time to spend with our patients. In fact, that's probably one of my biggest challenges, is lack of time. In medicine, there's an expectation to work efficiently and to meet time constraints. But we can use our time, the time we do have, we can use it well by really listening and recognizing the dignity in each patient. We don't necessarily have to talk about Christ to bring Christ to our patients. It is in our mannerisms, actions, our empathy, the way we dress and present ourselves, and in how we respond to our patients' questions and concerns. We in the medical profession face immense stressors: time constraints, documentation, low staffing, legal concerns, family problems, and the list goes on. It would take a miracle for a doctor, PA, or nurse to enter this chaos, tension, and pain, and bring calm, gentleness, compassion, humor, concern, hope, even joy. But it is just such a miracle that we can expect every day, many times a day, from the presence and power of our Eucharistic Lord.
And now I'll just leave you with this thought that has been a source of inspiration to me throughout my own practice and my own formation as a nurse. It refers to doctors, but I think my dad would also agree that it applies to anybody in the healthcare field. As doctors, we should not forget that we are not really the ones who cure a patient of an illness. Rather, it is God working through us who cures. It follows then that to be a good physician, we not only have to learn the art of medicine, we also have to be in tune with our Creator and His holy will. And unless we integrate prayer with our practices, we will be neglecting a most powerful and real source of aid and comfort to ourselves and our patients. Something that I struggle with on a regular basis because of my own conscience and because of, I submit to the authority of the church in this. Elective sterilization or abortion is something that I, with my paradigm, as I started to touch on, find inconsistent with true health care for the person. And this isn't a judgment call on anybody who makes that decision. I think that there are a lot of well-intentioned people, including myself, who sometimes intend to do something very good, but without real understanding of all the implications that it has, might not necessarily end with a good thing, And I dismiss myself from those rooms, and it's sometimes a source of great tension. Because it's inconvenient, because I could have started the room, and now they have to wait a little bit longer, or something. So that's kind of an element where I haven't followed through and had to do it, fortunately, but is a source in which I struggle daily with it. But I can't articulate any time when I've actually followed through by the grace of God. It's something that I really thought was wrong. The times that I felt that I've spoken up or dismissed myself in all professionalism. But
The one thing always on my way into work, I pray, Lord, I offer up my day for you, and I pray for my patients, for myself, that I can take care of them well. I pray that I don't do any harm to any of them, and pray for the other providers who I work with. I know for a while, I was feeling so frustrated because of the lack of time I had to pray with family life and work. But it became clear to me that when we offer up everything we do in our day, when we just accept that this is God's will, for me it was always, I was trying to get my morning prayer in and then my kids would wake up. But it was, that's what the Lord's asking me to do right now. So then if I just, accept that cheerfully without complaining, whatever it is in that moment, whether it's at work, you felt like, oh, maybe I could take my lunch now, but then so-and-so's family member just got here and, they have some questions that they wanted to talk to you about. If you can cheerfully go and do that, those things aren't just good things or things that you should do. Those things that's prayer. That's, offering up your prayer to God. So getting in that routine is really the way to go. But even when you can't do that, just to remember that offering up your day and everything you do, that's prayer also.
Story when I was in Afghanistan with the Army Forward Surgical Team, and one of the awful things that happened is we saw, I think, 24 pediatric patients in the couple months we were there. And one time, an IED went off, and a beautiful little 4-year-old Afghan girl came in, and she had a lethal head injury. One of our anesthetists intubated her right away, and so she was on a ventilator. Eventually, we got her father in. Her father's, didn't speak, no English, so we had the interpreter, the chaplain, the nurses, and the doctors, and there was this chain of people. And the father at one point asked us if he could maybe take her to another hospital where they could do something else, and we spent a good deal of time explaining to him. And eventually we got to the point where it seemed like he understood, and he made the decision. We were ready to keep her on life support for a time, but he made the decision to stop the life support. And I think it was important that we were there to help him understand